Here's my calcaneal tendon. I can go all the way up. Relax. You can also have them flex the knee. This will help me find those upper, that head, relax, of gastrocnemius. Flex your knee one more time. There we go. And relax. This is where it splits. Sometimes can be harder to find because popliteus attaches a little bit lower. That also pops up when you pass the knee, or when you ask them to flex the knee. So he's got a really strong popliteus. I don't know if you could see, push against my hand, right there. That bulk. Relax. That's popliteus pushing up with the upper heads of gastrocnemius. Won't always look like that on everybody. Does on him. Good job on your popliteus. The first step after that, or next step after that.
Myofascial release.
Myofascial release. We can do some torquing. We can do some pincher holds. Hold. What are we going to be mindful of down the middle?
Tibial nerve.
Tibial nerve. Good job. And also this. Get low with it. Maybe skin roll. I would soften him up a lot more before I would attempt that. Depending on the leg in front of you, you could possibly do some pin and post. Again, that's more of a stretching versus a compression. Warm that up, 10 minutes. Next, we're going to go to, make sure the foot stays in a neutral position, not dorsiflex, not plantar flex, completely neutral. We're going to generate some heat and work that calcaneus tendon. You could even use the palm, the heel of your hand there. Make sure your fingers stay relaxed. They're not like rigid. Next, pinchy pinch. All the way up. All the way up. If you didn't do it before, now we're targeting more of a treatment versus a myofascial release. Take it all the way up. Holding each grab for up to a minute. All the way up. Lube. Deep stripping effleurage. So many times. Keep softening it up. Treat what you find. Find something. Hold for how long roughly?
8 to 12 seconds.
8 to 12 seconds. Hold on this side. Circular friction. So we're deep. Circular friction getting lighter and more superficial with each pass. About 6 circles, 6 to 9 circles. Nice little effleurage to flush. You can keep softening. You can do a little petrissage. Make it feel good. We're softening gastroc to get to the deeper muscles. After that, we're going to target soleus, displacing gastrocnemius off to one side, so hitting it medially. Doing the same thing, deep stripping effleurage, trigger point compression. Same thing laterally, displacing gastrocnemius medially. Deep strip effleurage, treat what you find. Keep going through the center mass, treat what you find. Come down to the feet, work the feet, soften up. You can also incorporate this with your myofascial release to kind of really open things up. So I'm using my thumbs to open. I can bend the knee. Open it that way. Notice how I got lower beneath my work so my wrists weren't. Deep strip effleurage. Treat what you find. Traction, friction, every single toe, the calcaneus, because remember it attaches here. Just treat all the things in the bottom. Come back up. Effleurage up. Find the attachment sites of gastrocnemius, which go up onto the femur. So flex and relax. So I kind of lose it here because when I had him flex his knee, his hamstrings also activate. But I can feel right here was the border between the two. So I can friction these a few different ways. Compress, friction, because I'm activating his muscle right now. can do it on my own. Some circular frictions. You can use palms if that's too much. A few options. To treat popliteus and plantaris, right in the middle, usually just above the crease of the knee. Bend, press in. Sorry, you see how his muscle jumps? He's not ready for that deeper treatment. This is the last thing you do, plantaris and popliteus. Bend the knee, press in, a lot harder. And for me, I press in, I remain stationary. Again, bounce the knee. Another option, bend and hold, and then you move it, right?
The plantaris or popliteus?
Yeah, both, because
Popliteus.
we flip.
Yeah, popliteus you move with the fibers.
Yeah.
And so it's stationary and you move with it.
Yeah, so opposite type of treatment. They remain stationary in a slightly flexed position, and you move. Or you remain stationary and they move.
So that's really the only time you're ever putting pressure on the
Right,
body.
right. If you feel a pulse, just come out and try again. The artery does not want to be compressed. Arteries are kind of like al dente noodles, where they're a little bit soft and a little bit hard in the center, and they'll actually kind of roll away from you. Veins will be compressed. They'll just squish down. And arteries are going to roll away. If you feel a strong pulse, try that popliteal artery, just come out, reposition your finger, and go again. Did I miss anything? That was quick.